morning, good afternoon, and good evening, wherever you are in the world. Thank you so much for joining us today. This meeting is a side event to the 66th session of the UN Commission on the Status of Women. And while we are not able to gather together in New York this year, we're very glad that we can gather with you here virtually. This event will be translated to Spanish and French. So if this is your choice, there is an interpretation button that looks like the globe in the lower right corner of your screen, and you have to select your language. And please do so even if your selection is English, as not all speakers will be speaking in English today. This event is co-organized by so many groups, and I want to acknowledge them. So we have with us today Human Rights in Childbirth, Feminista, the International Stillbirth Alliance, the National Birth Equity Collaborative. We have the International Confederation of Midwives, the International Council of Nurses, the International Pediatric Association, the Council of International Neonatal Nurses, and the Federation of Obstetricians and Gynecologists. Thank you so much for joining us today for this very important for us event. I'll turn it over now to my colleague Angela Nguku, who will be facilitating the meeting. Thank you.
Thank you so much. Good afternoon from Nairobi, good evening where you are, good morning, good night. My name is Angela Nguku. I'm midwife by profession, and I'm really glad to be here speaking on and moderating this important conversation that I've been talking about for the last few years since I started working. We are talking about respectful and dignified care mostly in our health facilities, especially for women when they go to deliver or they take their babies for immunization, or more so during delivery for the mother and the newborn. And as such, I'm sure, because I've worked in different countries, this respect is something that is common, that it has been talked about, that WHO has guidelines around the same. Different countries have adopted policies and guidelines on how to go to ensure that respect is actually upheld. But we keep on hearing women talking about being abused, being disrespected in so many spheres. And so this really stops women and girls from going to health facilities to seek healthcare services. And as such, I think today is really an important conversation when we are talking about issues around women during this sixth convention, to really bring to you the discussion and to have us having conversations with professional bodies, talking about and listening to women, talking about what is it that we ought to do to really elevate the issues and take action once and for all. Let me start by telling you the story from the What Women Want campaign that was actually undertaken by White Ribbon Alliance and some partners who are here and others who are not here in different countries across 114 countries across the world. And this campaign reached 1.2 million women across board. And we sought to understand from women and girls, what does quality reproductive healthcare mean to you? And it was a shocker to us, and I'm sure it's a shocker for you. Some of you have already heard about the survey, some of you have not heard about the survey. To really hear women talk about respect and dignity, and not just from the clinical perspective of what that means, but from simple issues that you and me can actually address. And so today it's important that we elevate the voices of these women here, and here listen to them, and together come up with a way forward. How do we ensure that we stop this which has been really hailing us for such a long time? Women and girls from across these different countries told us that respect and dignity means different things to them. It means smiling to me when I come to the health facility, telling me what you are doing to me, taking my vital signs when you are telling me what's going on. It's about not despising them, not trivializing their issues, listening to them when they are discussing to you. And as such, health providers were at the forefront. They're the ones that women are really, they're the ones they find in the health facility. They're the ones that women told us, can you tell the nurses, the clinical officer, the pediatricians, can you tell the doctors, can you tell the physiotherapists, can you tell the different people what it is that we really want? And so today, it's important that we have this conversation and really situate these issues around us and ask ourselves, what is the way forward as professional bodies, as women, as implementers, as donors, as government bodies, as different players in the space? What is it that we are going to do to really ensure that women get the respect and dignity that they deserve in health facilities? I think we cannot underestimate the power of COVID in the last 2 years, that the pandemic has actually really like shut down everything that was going on. We've seen in spaces, in health, in governments, in countries, the COVID pandemic taking center stage, and actually the gains that we've made, even as the little we've done to ensure that respect to dignified care is really on the forefront, it has actually gone back because we've seen services, COVID response take over services that are meant for sexual and reproductive health and rights for women and girls. And that what meant that more disrespect, women were denied health facilities, the abuse was even much more. And it was actually complicated by the issues that we had about gender-based violence and all that. And so I think today, because women told us that health providers, and not necessarily any specific ones, because when women go to the health facility, they are not seeking to speak to a midwife or a nurse. They find a health provider, and what takes them there is actually that care that they are really yearning for, that we are telling them that come to the health facility. So I think it's important today that working together with women, health providers come together as a team to see how we can have shared goals. How can we help each other to ensure that we, women and girls, and all of us have what we need? Because at the end of the day, it's about improving health outcomes, maternal newborn outcomes, child outcomes, and so many outcomes. I said, my name is Angela Nguku. I am the Deputy Chief Executive Officer at White Newborn Alliance. I'm also a graduate midwife and really been working in this space in different countries across Africa, Asia, and Latin America for the last 17 years. And so today, really, it's not about us as White Newborn Alliance, but elevating the stories of women, bringing them to you to hear them today, and listening to professional body leaders across different groups in the world to really tell us what is it that we ought to do to address this issue that has really like remained so stagnant in our lives. And so today, it's not about us, it's not about you, it's about the women and girls and health providers. So today, we want to hear from different women from across different spaces who have had good and bad experiences and see how is it that together we can really have this conversation and commit to ending this. And so my first speaker today is Ninabina Devi, who is from Tanzania. She's a member of the International Youth Alliance for Family Planning, a youth advocate working with the Tanzania Youth and Adolescent Reproductive Health Coalition and an FP 2030 focal point. At 21, she became a mother. And we know what it means to be an adolescent mother, a young mother, and what the issues are in health facilities when they go to seek services. So without wasting time, I really want to call on Ninabina to tell us a story on what really she has experienced and what you and me need to take action to ensure that our issues are listened to. Welcome, Ninabina.
Thank you, Angela. Greetings, everyone. My name's Anina Bina, and I'm an advocate and a mother from Tanzania. Back in 2016, when I was still in my second year of university and trying to figure out what to do next and listening to the professors, it was a very difficult time to know that I was pregnant. And the first thing was, what was I going to tell my parents? But that was the easier part. Going first time to the clinic was a very tricky part because first I had to bring my partner with me so that I don't have to stay longer on the line just to get service. And then came the nurse asking, how old are you? And I was like, I'm 21. He's like, where's your partner? I was like, he's not here. Why are you still in union? Why are you pregnant? And it was a very hard question. And then I lost all the confidence that I had. That was the first journey, but I kept strong and told myself, I'm going through with this. Months went and it was time for my delivery. And I was lucky because I had health insurance and I was able to go to a private hospital, which at then I thought this was going to be the best place for me and for my baby. As sad as it was, I was in so much pain, but every nurse kept telling me, no, wait a little longer. You don't need medicine. You just need to wait. Your time will come. As sad as that was, I had to scream my lungs out just for them to hear me. It was an evening. I was the only one on the delivery table that day. To be frank, it was on the 21st December. So it was a Christmas Eve. Not many people were there. I had a safe delivery, yes. But back then I didn't know what would happen next. realizing that I was not given a chance to be asked if I wanted to have any postpartum care, if I wanted to use contraceptive, if I wanted to have any other services. And that went on. As hard as it was, I still believed I was lucky. Going back to seeing how other girls were treated during the line, or who did not have health insurance, or who did not know one of the healthcare providers, it was really difficult because you have to explain yourself why you're there alone. You have to explain yourself why you're there and you're young. You have to explain yourself why you're not with your parents. And it was a very, very difficult journey. This made me realize that maybe it's not about the age, it's about the service that we want. It's about what we want to hear from everyone else. I just want to come in and be asked, how are you doing today? Are you feeling okay? How is the baby? Are you hearing the kicks? What do you want to do next? Are you okay mentally? And things like that. That's the only thing we would want to hear. Realizing that it was because of the stigma, or it was because of not understanding what I wanted, but I do not want any other girl now or any time next to feel the way I felt, to feel stigmatized, to wait until the last 1 hour of the service to go, just because I do not want to stay long on the line, or just because the nurse already has attended so many people, so they'll just do it really quickly and won't ask me so hard questions that I would not feel like answering. Thank you.
Thank you so much, Nabina. Thank you for sharing your story. As I said, during the What Women Want campaign, we had so many stories like Nabina's, stories that you and me need to hear more so that we can change our approach, our way of doing things, and that we can work with others to actually ensure that quality healthcare, respectful, dignified healthcare is a preserve for everybody, irrespective of whatever age, whatever state, wherever they are in the world, and so on and so forth. So really a pleasure to have you share your story. And we hope that your story will inspire many more people, health workers, change makers, to really make a difference in women and girls' lives. I want us to move to Philippines. We want to call on Carla Africa Villanueva, who is a mother and an IT business analyst from the Philippines. Her firstborn child died due to oxytocin overdose, and she has been seeking accountability from the country's medical and justice systems. It is not a easy story to share, but I believe that her story is going to make a change or an impact to somebody to really change, or to bring others to speak up so that change can be realized. Thank you so much, Carla, for agreeing to speak with us. The floor is yours.
Thank you. My name is Carla Villanueva, 39 years old, Filipina. I am a mother and an advocate. And this is my first time ever giving a speech. I'm so honored that at my first, I get to speak in front of many medical professionals who gives respect and dignity to all women, mothers, and newborn children around the world. 8 years ago, we are happy to know that after a couple of years married, I finally became pregnant with my first child. When I first saw the heartbeat from the ultrasound monitor, I felt right away the love and the impulse to protect that little life within me. I made decisions in my life that were based mainly because I wanted to give my child the best possible chance to be safe and healthy inside me. I immediately bought the list of vitamins that were prescribed. I added more fruits and vegetables in my diet. I became more watchful of the cleanliness of the food I eat. I chose then I thought it was best hospital near our place so that I can immediately be brought to it when I'm due. I visited a couple of OB-GYNs and chose whom I think will best take care of me. I never missed a monthly prenatal checkup, and in all those appointments, every single time, it brings joy to me to know how well my baby is in my womb. I was so excited to meet her. Even before I met her, I already loved her and named her Therese. And so, right after the day of the supposedly due date, I felt a sudden gush of water and I knew that the moment I have been waiting for has arrived. I was happy, excited, and determined to endure labor pain. I am ready. We called up my doctor and she told me to go immediately to the hospital. I feel so secured. I trusted her. I trust that since she knows immediately that the baby is coming, she will be there for me and take care of me and my child, and everything will go on smoothly. When I arrived at the ER at around 1 a.m., the ER doctor was in touch with my doctor through mobile phone. I still feel secure, and I believe that my doctor is on her way. The ER doctor checked my vital signs and my baby's heartbeat. It was all normal. At this point, I still believe that I will meet my Therese soon. Little did I know that what's supposedly the happiest day of my life would turn out to be the greatest nightmare. More than 4 hours has passed, and I haven't seen my doctor yet, but it's okay. I am patiently waiting in a hospital room, and I still feel safe because periodically, about around 1 hour interval, the nurse would come and check my blood pressure and fetal heartbeat. As I hear the familiar sound of Therese's heart, I know that she's fine. She's also moving around my stomach too, like the usual. This makes me feel secure that she is safe, and I know at the moment that she's excited to see me too. Until 4:40 a.m. At this time, the contractions are increasing with about 5 minutes interval. The private room nurse came back to check my vital signs and heartbeat. Still normal, but that was the last time I ever heard her heartbeat again. The nurse told me that my doctor instructed to infuse oxytocin in IV fluid. She did it without electric fetal monitoring. Being a first-time mom and have no idea what oxytocin is, what's it for, and what it does at that time, I have no idea that this drug can be harmful to me and my child. After that, from the regular hospital room where I am, I was told that they will transfer me to the labor room. 3 nurses were there when we arrived. In a few minutes after bedside endorsements, 2 of them started to hook me up to an electrofetal monitoring. They secured the straps, but couldn't find Therese's heartbeat anymore. They had to check 4 more doctors, believing that those are just detectives. 3 nurses that could have known that there is something wrong were all reluctant because they are only following the doctor's instructions. Around 6:30 a.m., my doctor finally arrived. Panicked. I can no longer feel the motion of my child this time. I was so scared. My doctor did an emergency cesarean. I was droopy, but I can vividly remember how I saw her limp body taken out from me before I fell asleep as an effect of the anesthesia. When I woke up at 8:30 a.m., I felt like I woke up from a nightmare. I was looking for her. Where is everybody? I asked where my husband and child are. My husband is actually weeping in the hallway, holding my child, trying to resuscitate her. Therese was pronounced dead in intrauterine, but like me, my husband couldn't just give up. He handed Therese over in my arms. She was so beautiful. She was just like a sleeping angel. It was too painful to remember how she looks like. I feel like I am to blame. I thought I failed her. She was excited for that moment to be with us. We were excited for that moment, but I failed her. And I was failed by those nurses and doctors that I entrusted mine and my child's life. No one could really explain how a once healthy heartbeat of a thriving little life suddenly is now dead. They gave me no explanation. Naturally, I needed an answer. I researched about oxytocin in full-term labor, and myriads of literatures are already available over the internet. I then realized that there is a lot of medical errors about my incident. First and foremost, it clearly violated my right to informed consent. My doctor never discussed to me that she will perform augmentation of labor, so I thought it is just a normal part of birth procedure. Have I known that this drug can be detrimental to my child's life, I could have chosen to wait a bit more as my contractions are already progressing. My doctor was not even physically there to make a clinical assessment and call for that decision. How wrong is that? Secondly, the nurse injected 10 units of oxytocin into a bag of intravenous fluids that was already in use, which is more or less around 500 ml. It did not change the drip flow, which is originally set at to 125 ml per hour. This clearly does not follow the best practices for a high alert medication like oxytocin. Lastly, continuous electric fetal monitoring should be performed for a minimum of 20 minutes before starting oxytocin and should be continued until the baby is delivered. In my case, oxytocin was administered without any proper monitoring. I was in a moving bed going to the labor room when my stomach hardened. And when I'm telling this thing to my nurse, she told me that it would even progress more in the next few minutes, and even shook the bag of fluid as a response. Everything were just very wrong. And I was astounded to know all of this by just reading information readily available online. If only the hospital has a proper guideline or proper training given to those young nurses, they could at least have known the safety and guidelines in using oxytocin in induction of labor. Moreover, my doctor was not in the premise. Would she be there available in a few minutes to perform emergency cesarean? My daughter could have been alive. Oxytocin drip started around 4:40 a.m. The cesarean procedure started at almost 7 a.m. That's more than 2 hours in between. I know and I understand in my heart why my daughter died. I fought to give her justice. I went to all the local health organizations I know that I thought would help me. No one really did. I was in constant search for an OB/GYN doctor to stand before me at the trial as an expert witness. Not one is willing, and almost all of those people I've spoken to would deny the medical errors that transpired. But I just can't be shaken. Most of them even judged me and labeled me crazy for even trying to talk to them. But I never lose hope. After maybe 5 or 6 years of trying to find someone to stand before me, I finally have found an organization, ironically from another country, because my own country has already failed me. Until 2009, when I reached out to human rights in childbirth, and luckily the representative that here was an OB/GYN and has a beautiful heart. Dr. Nicholas Rashkin flew all the way from San Francisco and represented me as a medical expert. For more than 8 years of legal battle, I endured a lot of heartaches and suffered exhaustion mentally, emotionally, physically, and spiritually. On several occasions, I heard a lot of discouragements, even from people close to me. We lack resources to finance our battle. My health deteriorated, people intervening to justice system. Just this month, we received the decision. We lost the case. But looking back, without any hesitations, even if I already know I would only lose, I think that I'd still do the same, because I would do anything for my child, my firstborn. And I hope despite losing this battle, she's proud, and that I have made her feel a mother's love. That's all.
Thank you so much, Carla. And I would want us to really take a moment of silence in honor of Teresa, who is the late daughter of Carla, and all the other newborns who die as a result of our negligence, as a result of disrespect, as a result of not listening, as a result of not sharing, so as a result of the fights within the healthcare system. So let's just take like 30 seconds in honor of her, Teresa, and other children or newborns who died as a result of poor quality of care. Thank you, everybody. Carla received virtual hugs all the way from Kenya and from so many people who are on the chat, really like standing in solidarity with you, and really brave for you to share such a story. I don't think it's an easy story to share, but I believe your story can shape so many policies, programs, the way we do things as health workers. Thank you so much. And I just hope that this conversation that we're having today is going to really to stop such issues from happening again. They are not easy. I always say, as a midwife, as a mother, 9 months of carrying a pregnancy, and then you don't see it at the end of the day. It is not something we should just stop and talk about and write about and not think through it. So thank you so much for sharing your story. And I want us at this moment in time, as we go reflecting on the different stories we are hearing from different parts of the world, to really think back and ask ourselves, what is our role in our different spaces? How are we doing? How are we helping women and girls? How are we standing in solidarity? At the end of the day, what are we changing at the end of the day? So I want to take this back to a positive story from Kenya from the What Women Want campaign and what we've been able to do. So Molly, over to you. If you can play the video for us, for all of us to see and hear.
Ukifika hospitali, madaktari wengine wako friendly to them. They harass them, wanawaharas. Afu wengine wanawatreat, hata hawawezi kuwatreat kuwapea hiyo service wakati walemavu wanataka matibabu. When it comes to maternity, wanawake wa kujifungua wanapata vigumu, wanapata wakati mgumu kujifungua, hasa mambo na vitanda. Vitanda ziko friendly to them. Wengine hawawezi kupanda kwa hizo vitanda, so wanashindwa wafanye aje.
Wale wakati tulikuwa tunaenda kwa hospitali, tulikuwa tunapitia ugumu kama kutohudumiwa kwa haraka, kutoshughulikiwa kwa haraka, yani sababu wanatuona kama si ni watu watufai. Sasa wanatuacha tu pale. Pengine una guide, sinakuwa ngumu kufikia daktari. Tena mwenye naishi na ulemavu na niko mjamzito, na wakati nitakuja kujifungua nina matumaini kwamba nitapokelewa vizuri, kwa sababu wakati wanakuja kliniki napokelewa, na pia najua kitanda nitapewa kizuri sababu kuna mabadiliko. Mimi naona kwa kila department kwa hospitali watuwekee special doctors watu kutushughulikia, kama translator wa sign language, kaidas pia wakuwe, na pia wawe watu wa utu wenye wametrain kutulea watu sisi walemavu.
We are doing as facilities, we've been able to give them the first priority. Whenever they come, we are able to attend to them. And some of our facilities, we have specific people allocated that duty, so that whenever we are having people with disabilities coming to our facilities, we should give them the first priority, so that they can also feel as if they can have that feeling they are also taken care of, just like the other patients.
Nikifika pale kwa gate, nikikuja kwa hospitali napokelewa, nashikwa mkono, napelekwa hapo, nashughulikiwa mpaka venye nitamaliziwa tena nitafutiwe pikipiki nirudi nyumbani. Na hakuna kupanga laini, hakuna kusukumana eti foleni kwa laini, hakuna kusikrambo. Tunatengewa, tunashughulikiwa kwa haraka, na tunaongelesha tena kwa nidhamu.
Thank you so much. For those who might not understand what the video was all about. So when we undertook the What Women Want campaign in Kenya some years back, we spoke to women and girls living with disability, and they did tell us that they were really very much abused in our health facilities. And we started a program, the UHC for Me program, which sought to elevate the voices, work with women and girls living with disability to elevate the voices to health providers, policymakers, and programmers. And we've seen changes in the different facilities. So they are speaking to what was before and what is now. Now they have delivery beds that are disability friendly. They have sign language interpreters, they have ramps, they have wheelchairs. And so change is possible. And together working with women and girls, we can actually see the change happen, even if we are willing to walk the talk. So without much, because in the interest of time, I would want us to go to our next speaker of the day, who is basically going to share stories, experience also. This time we are going to get to hear from Joanna Francis Bonne, who is from Ecuador. She's a Black feminist, a social activist on human rights issues, and the co-founder of the Women of Aspat Collective. She has been recognized for her work as a human rights defender and for inclusive processes for Afro-descendants in Ecuador. Joanna Francis, the floor is yours. Thank you.
Buenos días con todos y con todas. Una alegría poder compartir con ustedes esto, pero también que sea también un llamado a la reflexión. Bueno, desde Ecuador, la pandemia nos mantiene en duelo justamente por un sistema de salud que a partir de hace 5 años tuvo una precarización mucho más elevada. Una precarización que se debe además a temas más políticos de gobierno y que desgraciadamente las comunidades negras y las comunidades indígenas son las más afectadas por esos cambios. ¿Qué significa acceder a las mujeres negras a salud en el Ecuador en estos momentos? Es también hablar de racismo dentro del sistema, de no ser atendidas, de tener sus partos fuera del hospital. Además, la pandemia precarizó mucho más el acceso al sistema de salud, dejándonos en indefensión con relación al acceso a un derecho que debería ser como la base primordial. Una de las cosas que marcó además la pandemia a nivel personal y a nivel comunitario tiene que ver además el no contar además ni siquiera con accesos a temas simples, ¿no? Que se vean universalizados como el agua, como las vacunas, como a tratar una emergencia sanitaria sin tener acceso a lo más mínimo. En estos momentos creo que vivimos una etapa crucial cuando nos referimos a que nuestros impactos en acceso tiene que ver también con el tema de que entran maquinarias para extracción minera, por ejemplo, pero no pueden entrar ambulancias a las comunidades que justamente están más aisladas, ¿no? Que no entra personal médico, que no ingresan medicinas, que no ingresa atención. Pero también reconocemos que la resiliencia de los territorios y de cómo han mostrado además el fortalecimiento de sus saberes ancestrales alrededor de mecanismos que puedan, a nivel de salud, que puedan como alcanzar y sostener la vida. Hablamos del uso de su medicina ancestral como tal, que ha sido siempre como la respuesta inmediata y preventiva ante la ausencia del Estado con un sistema de salud que funcione. Y hasta ahí mi intervención.
Thank you so much, Joanna. Thank you so much for sharing your story. I think it's always good to hear people who are moving, fighting, working to see change embraced in different spaces. And I think all of us are called to really be defenders of that respect, dignity, rights that we are all working for. Because at the end of the day, health is a basic human right and all of us should uphold it. I want us to go to another woman who also would want to share a personal story all the way from Argentina. And I experienced while receiving medical assistance for abortion. I would want to call upon her. I know she's in the team. Please, if you can share your story with us and for all of us to hear and really change the perspectives that we have as health workers, as professionals, as different players in the sector. Over to you.
Buenos días a todos, mi nombre es Ivana. Bueno, mi historia comenzó cuando quedé embarazada en un momento que no era oportuno, ni tampoco era mi deseo. Yo en el 2020, que fue cuando sucedió esto, yo ya era mamá, mi hija no llegaba al año, y la relación con mi pareja no era muy buena. Estaba bastante angustiada porque mi periodo no aparecía, y cuando lo confirmé con el test de embarazo, fui a ver a mi ginecóloga, quien me escuchó y contuvo en todo momento. Le dije que no quería seguir adelante, me explicó los métodos que había para hacer la interrupción y me recomendó que vaya a Casa Fusa para que me atendieran y llevaran adelante el procedimiento. En Fusa primero hice una ecografía, estaba de pocas semanas, me explicaron hasta cuándo tenía tiempo para interrumpirlo, y que al tener una cesárea reciente también yo corría riesgo de una rotura uterina en el caso de continuar con el embarazo. Luego de esto, la secretaria me informó que previo al turno médico iba a tener un encuentro con una trabajadora social y otras mujeres que estaban en la misma situación que yo. En esa reunión, la trabajadora social nos explicó los distintos momentos históricos y legales del aborto, hasta que se logró llegar a poder interrumpirlo si había un momento que lo justificara. En Argentina luego se aprobó la ley del aborto en diciembre del 2020, que fue un mes después de que yo hiciera la interrupción voluntaria del embarazo. En la charla, la trabajadora social nos informó los dos métodos posibles para llevar adelante el aborto. Bueno, uno era las pastillas abortivas, que eso se hacía desde la casa de uno, pero que requería más tiempo. Y el otro lo llevaba adelante un médico, era la interrupción con la asistencia médica. Fue este método el que yo decidí hacer. Cuando fui con la doctora, me explicó en qué consistía el procedimiento, me dio a firmar un consentimiento informado, explicó todo lo legal, y que una vez concluida la interrupción, podía optar por colocarme un DIU o un SIU. E hizo hincapié que lo que más importaba era que yo me sintiera bien tratada y contenida. Que en el caso de ser necesario también yo podía hablar con una psicóloga, pero esto no lo precisé porque yo ya por mi cuenta lo había tratado en mi propia terapia. La médica me dio las pastillas que debía tomar y de qué manera, hasta que llegara el momento en que ella interviniera. Algo muy importante es que ellos sabían que en la sala de espera estaba mi pareja, con quien, como dije anteriormente, no estaba teniendo una buena relación. Y la doctora me indicó que si en algún momento me llegara a incomodar algo que me pudiera decir mi pareja, que le avisara, porque le iban a solicitar que se retirara del lugar, porque lo que más importaba era que yo esté tranquila y me sienta bien. Al momento del procedimiento se respetó todo lo que tenía para decir, si sentía algún dolor. Tanto la médica y enfermera siempre preguntaban cómo me sentía, que de ser así avisara para darme algo y aliviarme. También dijo que si en algún momento me emocionaba, dijera lo que sentía, que ellas estaban para escucharme. La enfermera tomó mi mano, trataba de hablarme de cosas que me hicieran relajar. La médica también participaba de esa conversación. Y una vez que terminó, bueno, el procedimiento, sentí un dolor fuerte de contracción, que enseguida me dieron un calmante. Había decidido ya el método anticonceptivo, y recuerdo que la doctora, una vez que finalizó todo, me dijo, Ivana, relájate, y rompí en llanto. Fue porque tenía una mezcla de sentimientos encontrados, porque sentía mucho peso sobre mis hombros, hasta que me invadió un alivio enorme. Y recuerdo que a la doctora la abracé y le agradecí por liberarme, y a todos los médicos que intervinieron y me contuvieron, gracias. Hasta ahí llegó mi relato.
Thank you so much, Ivana. Thank you so much for sharing. I think these are all stories from different parts of the world, stories, positive stories, stories that are really grave, and stories that need to push us to really think and change and work with our different professions, with our different healthcare system, to really see to it that women get what they deserve when they come to us, because they have trusted that with their lives. I want at this moment to call on Elena Ateva, my colleague, to come and take us to the next level. Basically, what women and girls told us during the What Women Want campaign, what are their wants and what are their needs, especially when it comes to respect and dignity. Over to you, Elena.
Hi, everyone. And thank you so much for joining us and for staying with us. It is really my honor and my privilege to be here and to be speaking with you and to be speaking also on behalf of many, many others. You have heard from several women today who are sharing personal stories, but behind them, there are hundreds and millions standing because this is just a representation of what is happening. Both the positive stories and the negative ones, all right? And so we want to ensure that there are more positive stories like Ivana's, that women can come out of any experience with healthcare professionals more empowered and really feel that they were in partnership. When we access, and I put myself in that space as well, when we access healthcare facilities, we're going there because we need help and we need partners to be working with us. And that's really what women are asking us. My colleague Angela already spoke a little bit about the What Women Want campaign. It was really an exercise of shifting power, of putting it to women to say what they want, what they most need for their own health. Really asking an open-ended question: what do you want? What do you need for your own reproductive and maternal health care? And that's not usually a question women are asked ever, anywhere. What do you want is not something women are asked. And so even just asking the question is transformational. But it's important because then we make sure that whatever we're creating is responsive to women. We asked and received responses from nearly 1.2 million women from 114 countries. And you can see where the majority of responses came from. And we did it really the old-fashioned way. You can see that women were filling out responses on paper. We were processing those responses. We were coding them and categorizing in different categories. It was really a labor of love. We want to talk today about what those women are asking us to do. As Angela mentioned, one of their top demands was respect and dignity. And we looked at the responses and tried to put them into different themes, like what would make sense, and especially as we're asking today, professional organizations, what they can do to support women. We want to make sure that those asks are very specific to what the professional associations can do. The first really overwhelming desire from women is for professional organizations and really everybody to acknowledge systems of oppression. Women talked about the effect of racism, the effect of sexism, the effect of colonialism, really all of those different systems that still prevail and still impact on their life today. Women know when they're treated differently because they look different or they speak a different language, and that's something that's very top of mind. So these are our specific asks to professional associations, really to acknowledge that and to work towards dismantling those systems. Our next theme, and our next set of demands has to do with diversifying the different professions. Women essentially want to be helped by people who look and sound like them. This is the biggest difference that we can make, is to ensure that women are served by people from their own communities. And there's so much that professional organizations can do here in terms of diversifying their own structures and how they're set up, to supporting the recruitment of diverse populations at every level of the profession, really. Then developing guidelines for culturally competent education for anyone who is serving women and girls, and engaging and really relying on the community to support them to identify best practices for anti-racism, anti-discrimination, bias awareness. Next, women talked about being recognized as experts on their bodies, really having people listen to them. When a woman says it hurts, it means that it hurts. It doesn't matter what a machine says. It's really, pain is such a subjective experience. So really listening to women and involving as much as possible women in anything from education to training, that it's informed by women themselves. Women need to be involved also as members of professional and regulatory bodies. and their autonomy and decision-making needs to be acknowledged in any aspect of their care. And last but not least is really a focus on improving accountabilities. A lot of women talked about that. We heard about accountability or lack thereof today as well. And so this is really, really critical. Improving accountability between women and the providers who serve them, but also improving accountability between different types of providers, different groups of providers, so that at the end of the day, they're working together as a team and they're supporting as a team the woman who's in front of them. So our call to action today is really to the professional organizations who are attending here today, to adopt those principles in action, and not just in theory. Women are looking to see changes where they seek care. So we want to make sure that whatever we say here, whatever we do, really translates to actual change on the ground. There are different ways the global professional associations can embed those changes in their constitutions, strategic plans, advocacy agendas. They can amplify it through board resolutions, statements, and press releases, and include as requirements for membership for their member associations. We want to make sure also that we understand this is not an easy ask and it will take time, but we want to make sure that we have some mechanism annually to receive updates on what the professional associations are doing. Now, I've been speaking with the members that you'll hear from today from the different professional associations for quite some time now, and I know how committed they are to change. I know how both personally committed, but also organizationally, each one of them is to ensure that women and girls receive respectful and dignified care. This is, after all, why they joined the professions, why they're doing what they're doing. And I want to acknowledge that. And I want to acknowledge that we want to see meaningful change and that it will take time and that we're walking right beside you and supporting you in those changes. Because at the end of the day, this will benefit us, it will benefit you, and we really will be able to work together as a team. Thank you. Over to you, Angela.
Thank you so much, Elena. I think that is really our call to action, really to see the stories that we've just heard translating into stories of change, stories of positivity. And so in the interest of time, let me call each and every professional association that is represented here, because it's a healthcare, the healthcare team works as one. And so all of us have a role to play because we've had different stories and all this could have been handled by different professions across board. I want to start by calling on Franca Kadi. Franca is the president of the International Confederation of Midwives. She's an expert on sexual reproductive health care in general and midwifery in particular. She's currently a member of the executive board of the PMNCH, representing the Healthcare Professional Association. She's also a friend of mine and a fierce advocate for midwives and mothers. Over to you, Franca. Thank you.
Thank you so much, Angela. And I just want to show this, your demands, women's demands. And I first want to speak for all the healthcare professionals together. Thank you on behalf of all the healthcare professionals. Thank you to Ivana, Carla, to Nina Bina, and to Joanna, because I know your stories are the stories of many women and you're so brave to share them with us. We want to thank you for taking the lead, and we will stand, and that you will stand with us, so that you will stand with the healthcare professionals and help us to understand what you need. And as you're clearly saying, you want us to act, and we will act. So thank you for calling us to do that. Thank you also for helping us to work together on this, because I'm sure you understand when healthcare professionals respect each other, we're more able to respect the people that we care for. And so thank you for doing that as well. And also for supporting us with solutions. I found that the stories you told us today, there are already solutions there. Some of them are easier than others, but thank you for standing with us and providing us with these types of solutions. And I also see that you realize that this is a systems issue. We also, as healthcare professionals, have issues with our enabling environment. And if we work in an enabling environment, we are more able to give good care to you. Certainly on behalf of all the healthcare professionals, I promise you, every year you will receive feedback on what we're doing. Then on behalf of the International Confederation of Midwives, I want to share with you that we as midwives, we deeply understand this issue, and we are really, really willing to look at ourselves. I know it is not easy, but we will look at ourselves and our own behavior. And thank you for standing with us to do that. We do have regional and national workshops where we work on respectful care, and we really hope that you will help us to improve those workshops so that we can support midwives to give the respectful care that women and other people that give birth deserve. We've also started a push campaign, and in the push campaign, we're looking towards shifting gender norms, and we really fight for sexual reproductive health and rights. And the push campaign is not for midwives, it's for midwives and others with us, so also with women, and I'm very proud of that. And of course, we know that midwife-led continuity of care, where you build a relationship of trust. In many ways, it's so simple. That actually facilitates compassionate care. So we really, really believe that we are able to make a change. We really believe that we can show the change that we are making this year. The ICM has existed for 100 years. And I think that this year we will definitely make clear how we can make our care better and how we can provide an enabling environment for midwives to make the care better for women and other people that give birth, so that we can give quality care and compassionate care, and for you to receive what you demand and what is actually your right to receive. So thank you, and I'd very gladly pass over to the other teams, the other healthcare professionals that are with us today. Thank you.
Thank you, Franca, and really happy and looking forward to the push campaign and how this is going to translate in different spaces. Thank you so much for the commitment, and we will work together and see to it that we not just talk but walk the talk, and I know together we can do so much more. Let me turn it over to Karen Walker. Karen is the president of the Council of the National Neonatal Nurses and co-chair of the Knowledge and Evidence Working Group of PMNCH. She's a clinical professor at the University of Sydney and a neonatal clinical nurse consultant at Royal Prince Alfred Hospital in Sydney. I know it's late, Karen, but the floor is yours now. Thank you.
So much, and I too share this important document. The Council of International Neonatal Nurses, as the global voice for neonatal nurses, we advocate strongly that every mother, every baby and family that we care for should receive individualized, culturally appropriate and respectful care. COIN is collaborating with partners to decrease neonatal mortality and morbidity through strengthening and standardizing education and skills of those caring for the small and sick newborn. We have ensured that respectful care is integral to our education framework. We know that small and sick newborns who are admitted to neonatal intensive care units add additional stress to both the baby and the family unit. Neonatal nurses recognise this and the importance of supporting and caring for not just the smaller sick newborn, but for the family unit. And this is integral to our philosophy of partnering and respecting parents through models such as infant and family-centred developmental care. Respect is fundamental to the care that healthcare professionals provide, and this starts with respect for each other and for all our professions. We commit to stand with all our colleagues and professions here today to collaborate and speak with one voice to advocate that every woman, every baby, every child and their family have the right to respectful care. And I'd like to thank everybody for sharing their stories today. This is so important, and we listen to you and we hear you, and we will advocate for respectful care. Thank you so much.
Thank you so much, Karen. And it's really gives me a lot of, it gives me that energy to keep working with you, and together I believe we will be able to actually see this change. And so those commitments, I know they are not just commitments in paper, they are commitments that we are all going to work together, because everybody has a role in ensuring that maternal newborn health outcomes are really realized across board. Let me take this time to call on Mary Ann Lumsden, who is the Chief Executive Officer at the International Federation of Gynecology Obstetrics, FIGO. She's the past Senior Vice President for Strategy at the Royal College of Obstetricians and Gynecology in London. Mary, the floor is yours. Welcome, and give us your intervention on this issue. Thank you.
Thank you very much indeed for enabling me to take part in this very important session. Just because people will not necessarily be familiar, FIGO is comprised of over 130 autonomous national member societies. And recently we produced a new strategic plan and implementation strategy where respectful care underpins all our activities, everything we do in obstetrics and gynecology. It is incredibly important, as everybody on this call knows, that respect is shown to patients and families, as well as all the practitioners providing care, treating each other with respect. Without cooperation between all the professional groups, care will never be optimum. Respect isn't unidirectional, but is at risk with any systematic hierarchy of care. It is telling that the research around patient safety and improved care reduce hierarchies and stress collaborative patient-centered care. In this way, perhaps we can avoid some of the tragic situations that we heard about from Carla earlier on. In October 2021, FIGO restructured its committees and created one on health system strengthening and respectful care. This committee shares guidance and recommendations with all of our member societies that will ultimately strengthen the health systems. It also contains associate members, not all of whom are healthcare professionals, and these represent the breadth of all those who are involved to assure collaboration and really to broaden our perspectives by listening to others. In order to disseminate best practice so people can communicate what is correct, we try and send newsletters, organize webinars, congresses for all our friends and partners around the world. Our council is member societies, we have regional representation, and we bring the best guidance possible to our member societies around the world. They then take the responsibility of communicating with their own communities, and they do take this very seriously. Do we have examples now of how we are addressing respectful care? Most certainly we do. Just to choose one or two, there are initiatives that run through many of our member societies. For example, India made respectful care their theme a couple of years ago. And another initiative, which is global, is the International Childbirth Initiative that involves many organizations that are represented here. And it provides steps for all those involved in giving respectful mother, baby, family maternity care, and provides advice on how to embed evidence-based practice worldwide whilst taking account of women's wishes. Each member society is independent. However, we meet regularly to share learning, best practices, and an understanding of scholarly work. As I say, we need to communicate the correct evidence. FIGO bases its work on education, research, interpretation, advocacy, and capacity building. We will continue to collaborate with our societies and partners and all those on this call to achieve a knowledge base that we can also communicate to the women we care for, and so can honour women's demands. And we too look at with interest at this document. And thank you, Elena, for all your work on it.
Thank you so much, Mary Ann, for your commitment, and the FIGO itself, globally, but also in the different countries where it's the association is operating. So thank you so much for all the commitments. And I think I just want to reiterate what Mary Ann has said, that It's all of us really working together, because we are a team. We are not, there's no newborn, there's no mother, there's no pediatrician, without all of us working together to ensure we get that optimal health that all these mothers and newborns are coming to seek from us. Let me move now to ICN and Sylvia Ramblett. It's your turn now. She's representing the International Council of Nurses, a professor of nursing at the University of Lausanne in Switzerland with over 15 years of clinical experience in pediatric and neonatal care. A research program focuses on patient and family-centered care and pediatric pain management. The floor is yours, Anne, to tell us your commitment and your intervention in ensuring that stories like we've heard from Carla are not going to be the stories of tomorrow. Thank you. Over to you.
Thank you, Angela. And on behalf of the International Council of Nurses, which is, for those who don't know, a federation of more than 130 national nurses associations that represent actually more than 27 million nurses worldwide to ensure quality nursing care for all. It's really my pleasure to receive that document on behalf of ICN. Respect is really one of the core values of the nursing profession, and it's embedded in its code of ethics. Nurses should support and respect the dignity and the universal rights of all people, and that of course includes women, children, and adolescents, as well as the families at large. However, this mutual value is, if it's not respected between nurses themselves and between all other healthcare professionals like midwives, pediatricians, obstetricians, and all other healthcare workers, care to patients cannot be delivered to the expected quality standards. So respectful care should be embraced not only at individual level, but also at institutional level if we want to change the culture and translate it into the models of care that are existing or needs to be changed. For instance, if we want to truly treat women as partners in care and respect the demands, we nurses together with other healthcare professionals need to collaborate and speak one voice. So ICN pledges to support one voice to lobby and lead these necessary changes. And I would like to say hi to Michelle Acorn, who is here, who is the Chief Nurse Officer at ICN. Thank you for being here.
Thank you, Michelle. I don't know whether you also want to wave to the attendees and just in solidarity for ICN. Thank you, Michelle. I see you. Thank you so much for that commitment. Thank you so much. And together we will actually achieve all this because it's possible. Where there is a will, there is definitely a way. I want to call on Linda Arnold, who is Executive Officer of the International Pediatric Association and a pediatric emergency medicine physician at Yale University. She's a former Peace Corps volunteer with a long-standing commitment to improving global child health through interdisciplinary education, cross-sector collaboration, and respectful long-term partnerships. Linda, the floor is yours. What is your intervention and what are you committing to today? Thank you so much.
All right, welcome and thank you for the opportunity to participate in this wonderful initiative and collaboration among women around the world. I'm speaking today on behalf of the International Pediatric Association and as a practicing pediatrician for the past 30 years. The International Pediatric Association is the leading voice for children globally. It represents over 2 million pediatricians and over 1 billion children worldwide. And it does this by advocating for children's rights to health and well-being, by demanding that children's needs be prioritized, and by confronting inequalities in order to deliver the best possible care for every child, every age, everywhere. In order to do that, by nature, we have to collaborate and partner with other people. We have to try and bridge gaps and inequities to make sure that people's rights and access to high quality care are met. And we have to establish respectful relationships with our patients, or in the case of pediatrics, our patients' families as well. Our patients by nature are not really self-sufficient, right? And caring for infants and young children and even adolescents requires a team-based approach to care in partnership with families, in partnership with other healthcare providers for children. And from birth through adolescence, health and well-being of children is influenced by the health, well-being, knowledge, and nurturing care provided by their caregivers. So doing what's best for children requires respectful engagement with their families, prioritizing communication, interpreters if needed, to make sure that caregivers, mothers and parents can be active agents in their children's care, and that care is culturally competent. Families need to be informed, and children as well, consistent with development, and have a role in shared decision-making and agency in their own care. And I mentioned earlier the idea of interdisciplinary collaboration. It's, when I think about it, I don't deliver the babies, right? From the very start, the babies come to me from the hands, or after they have been delivered by a midwife or a skilled provider in child delivery. And nurses, techs, physicians, specialists, many people are involved in the children's care. And if we can't collaborate together and work together on children's behalf, we're not going to be able to give children the outcomes that they deserve. In respecting care for women, I want to just remind everyone that respectful care for women begins with respectful care for girls and adolescents. Children learn what they see and what's modeled for them. And it's important for all of us as women and role models and healthcare providers to not only respect the needs of adolescent girls and their unique physical, mental, and sexual and reproductive health needs, but also to engage them in a way that gives them a sense of respect for themselves and autonomy, and will allow them to continue the cycle going forward. I look forward to working with all of you, and thank you again for giving me this opportunity.
Thank you so much, Linda. I really am impressed and really privileged to hear commitments coming from the broader healthcare professionals from across the world, and basically the healthcare team, because it's one team. It's not, one cannot exist without the other, and none is superior than the other. And really looking forward to seeing us walking that talk, because it's you and me and others that are going to work to ensure that what we are hearing from women in another year or so is a different story. And it cannot wait until 1 year. It has to start now, because as we are speaking here now, we are having women in delivery rooms. We are having women taking their baby for immunization. We are having women who are pregnant. They are having women who are going through what we are listening to here. The question is, what are we going to do to ensure that this stops? At this moment, I think we are coming to the end of it, but it's not yet, it's not the end. It's actually the beginning of it. It's the beginning of walking that talk. It's the beginning of us taking that initiative to change the narrative going forward. I want to call on Dubraka Simonik, a previous UN Special Rapporteur, Violence Against Women, an author. I love writing, and so when I see authors, I know it's something that they're passionate about for them to write. She's the author of a groundbreaking report on mistreatment and violence against women in reproductive health services, with a focus on childbirth. And I would really encourage all of us to really read this report, because at the end of the day, it is the issues that we are hearing from such reports that are really going to make us see, they paint the picture of what's happening in our different realities. Over to you to give us your closing remarks and really what next. Thank you.
So thank you very much for inviting me to participate in this very important event, side event during the 66th session of the Commission on the Status of Women. And I hope that in the future we will have in-person meetings here at the CSW that will address issues related to human rights-based approach to mistreatment and violence against women in reproductive health services, with focus on the obstetric violence. I would like to thank you for all your work in this area, and I'm seeing this panel as follow-up to report that you have mentioned that I have elaborated when I was UN Special Rapporteur on violence against women, its causes and consequences. And let me mention that it was kind of step in direction of placing this area within human rights framework, because previously we didn't have proper framework around reproductive rights of women during the childbirth addressed at the UN level. So for that reason, and listening many stories like stories that we have heard today, I would also like to thank Nina Bina, Carla, Jovana, Ivana for their stories from which we are really seeing what is happening around the world. Because when I was preparing this report, I have called for inputs, mandates. When they are doing so, they are trying to have many testimonies. I have also received inputs from professional organizations. Some of them are present today at this panel, and that was very important. But then it is important for all of us to sit together and to see how we are applying this notion that health is a basic human right. And I think that during Carla's testimony, it was clear that access to justice is very important, that we need to see health, women's reproductive health as a human right that should be observed by states, and systematic problems that needs to be addressed. We have also seen changes in Argentina, and I'm very glad that this was a positive story, because I have visited Argentina when I was special rapporteur. At that time, there was no right to decide with respect to abortion, and now we have seen experience from Ivana. But I would like also to focus back on those testimonies that I have received for preparation of my report. I have received more than 128 submissions, and what is very important, many testimonies are now available online. So based on those testimonies, we are seeing that this is not an isolated incident with respect to whatever is the story, personal story, that we are dealing with systemic problems that should be addressed by states. And for that reason, it is important to have human rights-based approach and to use UN instruments that are protecting women's rights in this area. So here we have Declaration on the Elimination of Violence Against Women that is clearly stating what is violence against women. And here I see that medical professionals are not seeing this term violence against women as appropriate, because the whole idea is that medical professionals are helping women, and it is true. But in the same time, there is a framework of state responsibilities for prevention of human rights violations and for provision of services that are needed in all circumstances. And we are all living in societies in which discrimination against women, violence against women in all areas of life are present. So we need to see that this type of continuation of this type of discrimination is also reflected in the area of reproductive right and health services. So in this area, what I have put in my recommendation was related to right to informed consent that should be better applied and strengthened. Then it will be important to have a proper education of physicians and those professionals and non-governmental organizations, and also independent human rights mechanisms dealing with this area. Also additional knowledge related to UN Convention on Elimination of All Forms of Discrimination against Women, and jurisprudence developed with respect to specific cases. We do have cases related to maternal health done by CEDAW committee, by regional mechanisms like European Court for Human Rights, Inter-American system, and so on, that are giving directions, that are giving good recommendations. Then it would be also important to look how to use this human rights framework to conduct independent investigation into what is really needed in different states all over the world. Situation is different. We should not say that the same tool is a tool for all countries, but we can apply the same set of human rights, and then see at the national level what is really needed. So states should address structural problems, lack of proper education and training on women's human rights, then heavy workloads in healthcare facilities, that is also obstacle for proper healthcare, budgetary constraints, and those constraints that are related to work in healthcare facilities. And then they need to also look into how to guarantee some protective measures like right to birth companion, because it is preventive tool for women that are going to hospitals. Then in some states, birth at home is not allowed. So there is also consideration how to go in that direction. There are no clear rules in this area, but because everything should be safe, but it should be also considered. Then data is very important, to have clear data about cesarean sections, about episiotomies, about different treatments and so on, about complaints. Of course, that would be also be important, and related to lack of anesthesia in some countries, lack of different treatments that are needed. So basically, it is important now with everything, with campaigns that are extremely important, to use human rights framework, because it is good to have different layers of obligations involved here, and rights also present for women in such situation, because they should not be isolated in thinking that this is an incident. They need to see that we all need to come together and work jointly in order to really move in direction of applying and seeing women's rights as human rights during the childbirth. Thank you. My report is available at the website of the Office of the High Commissioner for Human Rights, and I can put a reference in a chat box. Thank you.
Thank you so much. Again, really issues of what is happening, and I can really overemphasize what you've said, because disrespect and abuse happens in so many spaces, in different ways, in different forms, and all of us really need to be really aware of what we are doing, and what are the implications of that to the people, to the women, to the children, to the patients that we are really serving. I just want to, as we come to an end, I really cannot, I think there's so much that has been said, and there's so much that we need to take forward and digest. I want to call on of us to really hold ourselves accountable to what we've heard and what we committed to, and together, let's work together as a team to see that what we are hearing from women, we really honor their demands. And I would really want to just summarize on some of the things that we've heard through the What Women Want campaign, and also what we've heard from those who are brave enough to share their issues during our forum today. Women have told us that they want this respect. They want to stop being discriminated upon. They want to be given information on what is happening to them. They want to be supported. They do not want to be despised. They want to be called by name. They want doctors, they want nurses, they want midwives, they want clinicians, they want everybody who is taking care of them to stop laughing at them when they come. They want a partnership, a collaboration when they come to the health facility. They do not want to be mocked anymore. They want their rights back. They want that we keep time when we are giving care to them. And I'm saying we, because I told you I'm a midwife myself. And so the question that I'm going to ask you today as we leave this conversation, will you listen and act to women's demands? Will we honor them? Will we just honor them in paper or in practice? They have spoken. Will you ask? Will you listen? Will you act? I keep on saying it is very easy to be spoken at the global scene like now at the CSW. But the question is, will we take it down to the country level? How are we going to do to ensure that, because these issues are not happening at the UN headquarters in New York, they're happening in our different countries, at the local clinics and the like. What are we going to do to ensure that we become the champions of change in our different places? I call this the time for a revolution in the way we do things, a time of a radical act. And I'm asking you from White-Born Alliance and from my colleagues here, will you listen again, and will you act? And together, will we stop the indignified care and the disrespect that we are seeing, that we are hearing from across board? Thank you so much. I've been your moderator, Angela Nguku. I'm the Deputy CEO, White Ribbon Alliance, but I'm also a midwife and a very passionate midwife, really pushing to see that the issues of mothers and newborns are not just left at the backbench, and that our accountability starts with you and me before we can take it to the broader policy and system. Thank you so much, and really looking forward to see all of us working together to elevate the voices of women and honor their demands. Thank you, and bye-bye.